My question is to the Minister of Health. Does he stand by all his statements about health services?
The Honourable Tony Ryle.
Mr Speaker, yes, including the statement that the Labour Party culled off 30,000 people from hospital waiting lists.
Supplementary.
Honourable Ruth Dyson.
How do his statements relate to the concerns expressed by Kathy Janes, Clinical Advisor of Healthcare Aotearoa, who says that, quote, vulnerable patients will get sicker and more will have to go to hospital under proposed funding cuts for family doctor groups?
The Honourable Tony Ryle.
Mr Speaker, the government's been quite clear. We want to support frontline services in general practice, and we will be moving resources in order to increase the subsidies for GP visits.
The Honourable Ruth Dyson.
How can he justify spending $6 million preparing business cases for integrated family health centres, his flagship policy, when the primary care network covering most of Auckland has just ditched these centres in their proposal?
Honourable Tony Ryle.
Mr Speaker, the government's inherited a situation where the previous government made very little progress in implementing the primary health care strategy. And so what this government is doing is seeking to do that. It will provide better, more convenient services for New Zealanders.
Nikki Wagner.
Mr Speaker, to the Minister of Health, what other frontline services are improving?
Honourable Tony Ryle.
Mr Speaker, frontline services are improving in many parts of the public health service, particularly helped by the 1,100 extra nursing personnel that there are in the public health service.
Honourable Ruth Dyson.
Supplementary. How can he explain to the people of Palmerston North, Fielding and Levin, despite Nathan Guy's advocacy, that their district nursing's 24-hour service is under threat? The Diabetes Lifestyle Centre is under threat, the sexual health services are under threat, and the Star 3 Rehabilitation Centre for people under 65 is due for the chop as well.
Honourable Tony Ryle.
Mr Speaker, despite the government increasing Mid-Central's budget by $26 million this year, the government has inherited significant challenges with Mid-Central. There are a number of options on the table and decisions are still to be made. But I am determined that the people of that area should have certainty about their services and the District Health Board shouldn't career into financial crisis.
Question number 9, Te Oroa Flava.
Mr